How to instantly improve leg circulation and blood flow. Introduction. Welcome to our comprehensive guide on improving leg circulation and blood flow. In this article, we will provide you with valuable insights and practical tips to enhance your leg health and overall well-being. Whether you are looking to alleviate discomfort, prevent circulatory issues, or simply maintain optimal leg function, we have got you covered. Understanding leg circulation and blood flow. Before we dive into the strategies to improve leg circulation and blood flow, it's important to grasp the fundamentals. Your legs rely on a healthy circulatory system to deliver oxygen and nutrients while removing waste products. Poor leg circulation can lead to various conditions, including varicose veins, deep vein thrombosis, DVT, and edema. By prioritizing leg health, you can mitigate these risks and promote vitality. Stay active and engage in regular exercise. One of the most effective ways to enhance leg circulation and blood flow is through regular physical activity. Engaging in exercises that specifically target your lower body can strengthen the muscles, improve vascular health, and boost blood flow. Consider incorporating activities such as walking, jogging, swimming, cycling, and leg-focused strength training into your routine. Aim for at least 30 minutes of moderate-intensity exercise on most days of the week. Maintain a healthy diet. Proper nutrition plays a vital role in optimizing leg circulation and blood flow. A diet rich in essential nutrients can support vascular health and promote efficient blood flow throughout your legs. Include foods that are high in fiber, antioxidants, and omega-3 fatty acids. Incorporate fruits, vegetables, whole grains, lean proteins, and healthy fats into your meals. Stay hydrated by drinking an adequate amount of water daily to support overall circulation. Avoid prolonged sitting or standing. Sitting or standing for extended periods can impede blood flow to your legs, leading to discomfort and potential circulatory issues. Whenever possible, take breaks and incorporate movement into your daily routine. If you have a sedentary job, consider using a standing desk or adjusting your workstation to promote better circulation. When standing for long periods, shift your weight from one leg to another and perform simple leg exercises like calf raises or ankle rolls. Elevate your legs. Elevating your legs can provide instant relief and help improve leg circulation. When you have the opportunity, elevate your legs above heart level to allow gravity to assist blood flow back to your core. You can prop your legs on a stack of pillows or use specialized leg elevation devices. Aim to incorporate short periods of leg elevation throughout your day, especially after prolonged sitting or standing. Wear compression stockings. Compression stockings are a valuable tool in enhancing leg circulation. These specialized stockings apply gentle pressure to your legs, promoting blood flow and preventing blood from pooling in your lower extremities. Consult with a healthcare professional to determine the appropriate compression level and size for your needs. Regularly wearing compression stockings can provide relief from leg discomfort and reduce the risk of varicose veins. Massage therapy for improved circulation. Massage therapy can be an excellent addition to your leg circulation routine. It helps stimulate blood flow, relax muscles, and relieve tension. Consider scheduling regular sessions with a qualified massage therapist who specializes in circulatory massage techniques. If professional massage therapy is not accessible, you can also perform self-massage at home using gentle strokes and circular motions on your legs. Conclusion. By implementing the strategies outlined in this guide, you can effectively improve leg circulation and blood flow. Remember to stay active, maintain a healthy diet, avoid prolonged sitting or standing, elevate your legs, wear compression stockings, and consider massage therapy. Prioritize your leg health to prevent potential complications and promote a vibrant, active lifestyle. More information, please comment below. Thank you. Dr. Healthy Living.